Hey everyone, and as you can tell by my thumbnail, today I'm actually going to be talking about my blood work results because I got most of the tests back except for one, but for my other test results, I am not worried about that other test coming back before I do my video. So first, I'm just going to go over certain blood work that is like the most important of understanding what also correlates with heart disease along with cholesterol, and then I will kind of go over why I am not concerned, and there will also be links to videos and also articles in the description of this video that you guys are more than welcome to go view and also read about cholesterol. And normally I don't like to read off paper. I like to do my videos without having to have a piece of paper in front of me, but obviously for my blood work, I am going to have my blood work in front of me, that way I can read it off to you guys. So, I'm going to do a comparison of last June and then of this June, and as a reminder, I didn't start carnivore until October. So, I've only been carnivore for 8 months. I do plan on going back for another lipid panel in November or December, and that will be a year. It should be like a month or two after I've been a carnivore for a year, because I want to see where my lipid panel is in 6 more months. So just keep all that in mind. So I never really had blood pressure issues. I always actually had lower blood pressure, but last year I noticed my blood pressure was increasing. It's still very normal, but for me, I've always had low blood pressure and never had any symptoms from it. So last year's blood pressure was 115/77. This year's it's 110/70, which is actually kind of where I normally am, actually probably a little bit slightly lower. So I am sure that number is going to decrease as well. My A1C last year was 5.5%. This year, it is down to 5.1%. Whoop, whoop. Your optimal level for your A1C is either less than or equal to 5.4%. And mine is now in the optimal range, which is great. My C-peptide, I did not get done last year because I actually got 12 more labs done this year than I did last year. The reason for that is I did purchase Dr. Ken Berry's Common Sense Labs book, and I will also link that in the description as well, so you guys can go purchase this. It's very useful. It tells you what all the labs are for, what labs to request, and I requested the full lab annual work that you should get done, which is 12 more labs than what my doctor normally orders. So last year he did not test my C-peptide, so I don't have a reference range, but I'm pretty sure it was probably on the higher end. This year's C-peptide is 0.9, and the optimal range is 0.5 to 1.6. So I am on the like in between, which is perfect. And he also did not take my insulin last year. And this year, I did have him do my insulin level, and I'm at a 1.2. And to be optimal, you want to be less than 5. So, perfect. And my glucose last year was an 89. This year, my glucose is a 75. And the optimal range is between 65 and 86. So last year, I was actually a little bit over my optimal range, but now I'm like halfway between what is optimal, which is really good. All of my labs from last year were in range according to the lab work. Every lab is going to have their own reference range, but Dr. Berry's book gives you the optimal range, and obviously it's kind of going to vary too with your labs, right? But you want to be close to the optimal range as possible. And I also, my blood work from this year was all great. except for my cholesterol, which we will get into here in just a second. So I went over my blood pressure, my A1C, my C-peptides, my insulin, and my glucose for a reason. All of my levels for those are are optimal. I am perfect. My levels are great. Keep that in mind, okay, when I start talking about my cholesterol. And then also TSH, so your thyroid hormone, has something to do as well with cardiac disease. So last year my TSH level was 1.38. This year is a 1.74, and your optimal range is 0.5 to 2.0. So I am in my optimal range. Even last year I was fine. And I will talk about why TSH is important and why you want it to be higher and within those ranges. And then another thing to keep in mind is what my waist circumference was in my BMI. Now, I don't necessarily think BMI is the proper tool to use for your health, because you can be what they call skinny fat. So, but the waist to height ratios is a good thing to use as well. But like even with that, you can still be skinny fat. So there's that. That's why it's important to get blood work done, so you can see where you're at. But my waist circumference last June was 40 inches. And I'm going to use this. That's basically what I used when I started in October, because I'm sure I was that big in June, because I was not dieting last year at all until October. So I am now at a 29.75 inch waist. And for women, your optimal waist is anything less than a 34.6. So I am golden there. And plus with my waist to height ratio, I am under 0.5, which is what you actually want to be, is under 0.5 for that ratio. Now for my liver panel, to make sure my liver's functioning properly, there's 3 different tests that they can do, and they usually will do them when you do your annual blood work if you don't ask for them. So the first one is your ALP, and mine was 108 last year. This year I'm at 93. The optimal range is 70 to 100. So I was actually 8 over last year. So now I've decreased that, which means my liver and stuff is functioning better. My ALT last year was 17. This year it's 16. So it did go down, which is a good indicator that it's working more efficiently. And your optimal level is between 10 and 26. So good there. My AST was 21 last year, and this year my AST is 18, and the optimal range is 10 to 26. So my liver is not working as hard, which is good. And it's doing what it's supposed to. And also in this Common Sense Lab book, it goes over on a couple of the pages when you are wondering what each blood work will do, and like what it kind of indicates and why you should get it. It goes over what each of those tests for. So that's what makes it nice about this book, is you can go over and see what test is what as well, which is nice. So that way you're a little bit more informed, because a lot of times your doctor won't tell you what the tests are for when you get them done. They just be like, oh, you're in, they won't even contact you if you're in level and explain it or whatnot. And this book is nice, and it actually kind of goes over that stuff with you. So it's a very nice book to have as well. Another liver health test that you should get is called the GGT. Last year I didn't get it done. This year I did, because it's one of the ones I requested to make sure I got it done. I was at a 9. Optimal level is between 10 and 30. The standard, according to the lab that did my blood work, is 7 to 50. So I am a little bit on the lower range, but still within range. Not worried about it, because my other tests came back fine. And then my GFR, which is your kidney function, last year was 90. 90 or above is good. This year it was greater than 90, and that's the optimal range. So my kidneys are functioning perfectly. No kidney issues whatsoever with that. With all of those results, so my A1C, my C-peptides, my insulin, and my glucose are all down. Perfect. I'm well within range. I'm good. I am not diabetic. I'm not pre-diabetic. My body's functioning properly. By the way, I eat no carbs. I do not include dairy at all either. I eat literally very zero, and I know there's carbs in Element because of the stevia, but I literally eat zero carb. And my insulin and A1C and C-peptides and glucose levels are perfect. So you don't need carbs to maintain your glucose and your sugar in your body. Okay? Proof right here. So the big question, what everybody's been waiting for, my cholesterol. Let's talk about it. Okay. My total cholesterol last year was 194. My total cholesterol this year is 419. Okay? There is no official optimal range for cholesterol. Now, your doctor is going to say there is, but there is no actual optimal level. And I'm telling you right now, according to the lab paperwork, I am at a very high risk of heart disease. Okay? My LDL last year was 127. This year it is 312. Like I said, there is no reference, but according to the lab paperwork, that is high risk as well. So, my triglycerides, which is the number you want to be low, okay? Those are the true bad guys. Last year was 161. This year my triglycerides are 119. Okay, the optimal range, you want less than 100. So I still have 19 more to drop so I can be less than 100. So that's why I want to get my blood work drawn again in November to make sure my triglycerides are going down. Good on that my triglycerides are going down. So the standard range for your triglycerides is 0 to like 149. So in the standard range, I'm actually in the range this year than I was last year. Last year I was 161, so I was over that. My doctor didn't say anything to me, by the way, with that. Okay, which is upsetting because he would have said something to me about my total cholesterol, my LDL this year for sure. But last year I was over my triglycerides and he didn't say anything to me. And that number is important. That's one of the ones that matter. The other one that matters and should be concerning to your doctor if it's out of whack is your HDL. And my HDL last year was 53. This year it was 71, which is great because that's the one you want to have higher of. So you want your triglycerides to be low and you want your HDL to be high. Now, the optimal range for HDL is greater than 50. So last year I was at 53. Right, optimal. This year I'm at 71, which is very optimal and great. So my triglycerides were high last year. And my LDL last year, like I said, was 127. The cutoff is 129, so I was almost there. And my doctor still didn't say anything to me about maybe changing my diet, watching what I'm eating, exercising, doing something. Because I wasn't exercising at the time and I wasn't on a diet. Nothing. With my total cholesterol being 419 and my LDL being 312, my doctor probably would have called me after the test results. However, at my doctor appointment, I did inform my doctor that I am doing the carnivore diet. And I did warn him that my levels may be higher than what he's used to. And he said as long as they're not over 190, he's fine with it. And I was like, okay, well, if they're over 190, I'm not going on a statin. He's like, okay, so you're refusing a statin? And I said yes. One of the videos I linked in my description is how statins work and why they're not necessarily beneficial. They're beneficial to a point if you have a rare genetic form of high cholesterol that you do need to take a statin for. But that's a very rare occurrence and does not happen in everyone. Okay? Basically what a statin does is it gives you more LDL uptakes on your liver, because your liver is what absorbs your extra LDL in your blood. But those receptors are taking up the good LDL to put them back in your body, where the bad LDL is oxidized and is put into your bloodstream, and that's what causes plaque. What statins do, it just helps you, like, it helps your body reabsorb that good LDL, but not the bad one that causes plaque. It has nothing to do with that. So you continue to still have the bad LDL in your body and not like the good LDL. The video completely explains it medically because he's a doctor and he goes over it exactly in detail how a statin works. I highly recommend watching that before you decide to, 1, criticize me for not going on one, and 2, before you decide to put that in your body, because it has major effects, right? It affects your muscles, and what's a muscle? Your heart. So, depending on if you have that genetic high cholesterol issue, I would not recommend a statin, just from what I've learned. But you guys are more than willing to form your own opinions. But this is my opinion. I told my doctor I'm not going on a statin because of a few things. One of them being, you need to take into consideration what leads to cardiac disease or heart disease. It's multiple things. It's not just high cholesterol, okay? And those things include insulin resistance, inflammation, and oxidized stress, okay? Insulin resistance. I do not have. My blood work from all my glucose levels, A1C, and everything, like I said earlier, is perfect. I have no insulin resistance. My blood work for my white blood cells, red blood cells, all of that, and the other inflammation tests all came back with flying colors. I do not have inflammation either. Not a problem. So that's 2 out of the 3 major things. And then you have oxidized stress, because oxidized stress is what causes your good LDL, the fluffy stuff that your liver is going to reabsorb. It causes that not to become fluffy, and that's what goes into your blood cells, into your blood vessel walls, and that's what causes plaque. Now there's a whole mechanical thing of why the plaque forms. It's not the LDL, it's your immune system that actually eats that LDL because it's a foreign object in your blood vessel walls. Therefore, that's what causes the plaque. Like I said, watch that video because it goes over all of that and he explains it really well. I don't want to have to explain it like he did because he does a really good job. So just watch that video. And I also have a video on this channel that I did a few months ago talking about cholesterol and why actually it's very important to have cholesterol in your body. And there's also a study linked below as well that goes over why a higher cholesterol is actually better for you and you will actually live longer if you have a higher cholesterol than the cholesterol they recommend that you have. So look at that study as well. So cholesterol can be a reason for cardiac disease if you have those 3 things: insulin resistance, inflammation, and oxidized stress. Then yes, cholesterol can also be a concern. But since I am healthy overall, everything else is perfect. My triglycerides are almost under 100. My HDL is going up, which also helps because I'm working out. Lifting heavy helps your HDL level goes up. So that's perfect. Another thing I forgot to mention is what's important is your triglyceride and HDL ratio. Okay, so last year my triglyceride and HDL ratio was 3.03. This year it is a 1.67. That dropped drastically, which is great. So the optimal level and the standard level of where you want that triglyceride to HDL ratio to be is 2.0 or under. So I was over. I was at 3.03 last year. I was unhealthy, and yet my doctor didn't say anything to me, because most doctors don't know or comprehend or care. This year I'm at 1.67, so I am under 2.0, which is great, perfect. I'm going in the right direction. I am not worried about my total cholesterol or my LDL. If I was, there are a couple tests that I could take. So a couple of the tests I could take, I believe it's called an NMH test, and that's where they actually test your LDL sizes. So you have the larger size, which is the healthy LDL, and that's what you want. And then they have the small LDL, and that's not what you want, because that's what causes plaque. So you can get that test done if you're actually honestly concerned about your total cholesterol and LDL being high. I'm not, don't care, I'm not worried about the test. You can take that, you can have your doctor do that blood work test. And there's also the CAC scan, where they scan your arteries to see if you have any plaque buildup. And if you're under 100, you're good. If you are between 100 and 300, you're medium risk. So you can also get that scan done. But as a reminder, a lot of insurance companies won't pay for that, which is sad, because instead of doing more blood work and seeing what the problem is, like, do you have good, like, larger amounts of LDL, good LDL, or do you have large amounts of small LDL? They're just going to throw a statin at you, which is sad. They should be doing more blood work to make sure they are going to prescribe you what you need to be taking, because a statin, in my opinion, is not good for you to be taking. And if your LDL, your good large LDL molecules are where they're supposed to be, and so okay, sorry, my camera died, so I had to go get my other camera. As I was saying, there is blood work you can do, and your doctor should actually do those blood work tests and that scan before they prescribe you a statin. Because the scan is going to determine if you have plaque buildup. Because if you don't, there's no point. It's fine. And then if you take that other blood work test, it's going to tell you how many fluffy good LDL you have and how many small bad LDL you have. If you have a majority of your LDL is good, you don't need a statin either. What you need to do is just change your diet to a healthy whole foods diet as well, and add exercise. Now, I'm not saying you need a gym membership. Just normal everyday activity is perfectly fine. So please don't let your doctor prescribe you a statin without doing more testing. And testing all of your insulin levels. Your insulin, your glucose, your C-peptide, your A1C. Testing your liver, like all the liver tests. Testing your kidneys. Like, do all the tests first before you decide to take a statin. And then also change the way you're eating as well. Because the healthier you eat, the more bigger, fluffier LDL you have compared to the little LDL you'll have. Therefore, less damage you're going to be causing to your arteries. Because LDL is the one that actually does hurt you. Yes, it's the bad, but it's not bad. What's bad about it is the smaller particles, and then your immune system attacking those smaller particles that get inside your blood vessel walls. So it's a whole process. Your body's amazing. Research it first before you decide to take, honestly, any medication your doctor is going to give you. Research how it affects you, okay? Just putting that out there. You are your own best advocate. Doctors don't know everything. So most of the time they're just pushing medicine because they're getting paid to do it. So keep that in mind as well. All right, so I brought up earlier that I was going to talk about why a higher TSH is better than a lower one. And it actually is because TSH, the thyroid hormone, actually helps process cholesterol. And cholesterol is 100% extremely good for you. Your body actually makes 80% of the cholesterol in your body. Only 20% comes from your diet. Your cells, your brain, your heart, muscles, and everything need cholesterol to function properly. That's why it's not good that your doctor's trying to lower your level. So please, like I said, I can't emphasize enough to do your research before you make a decision. And there is more research coming out showing that cholesterol doesn't matter. What matters is all these other influential factors. Those matter, then cholesterol can matter if you have all these other markers. Okay, so one last thing is I wanted to talk about what they call a hyper-responder. I believe I'm going to be a hyper-responder, so my total cholesterol is going to be over 350, which obviously it is. It's 419. And they're actually doing research right now of what they're calling lean mass hyper-responders. So people that have BMIs in their normal range, they have, they're skinny, they work out, they have a lot more muscle than they do fat. They're saying those people actually have naturally higher cholesterol, which is good. That's what your body needs. Your body actually wants a higher cholesterol, not a lower one that they're trying to push. So I think the more fat I'm losing and the more muscle I am building and maintaining, I am probably eventually going to be what they call the lean mass hyper-responder. The only criteria I am missing to be classified as of right now a lean mass hyper-responder is that my HDL needs to be above 80, which it's a 71, so I'm almost there. And then my triglycerides actually need to be under 70, and I'm at 119. So I think over time, when I continue my workout and continue to lose my fat, I'm going to probably transition into one of those lean mass hyper responders. That's why I want to check my blood again in November, December, because I want to see where my levels are at, just to see where, like, the direction I'm going. And depending on what my doctor says to me at that appointment, I will probably tell him I want those 2 other tests done before he even thinks he's gonna prescribe me a statin. And even if he does, I'm not taking it. I don't want the side effects that it causes. It's not good, especially for someone that works out and wants their muscles to be muscles and not be fatigued and create all these other symptoms that I don't want. Don't want them at all. And like I said, I have no other indicators that I'm unhealthy. So I'm not concerned. But if my doctor is concerned, I will have him do those 2 other tests just to make sure that I'm 100% good. But I don't feel like I need to do that right now. Just so you guys are aware, my cholesterol is crazy high. But what matters most is my triglycerides are going down and my HDL is going up, and my ratio is under 2, which is perfect. And I have no other issues with my blood work. Everything else is flawless. I'm in optimal range with the majority of all my blood work, and I'm not concerned at all, especially only being 8 months carnivore. I know my blood work is just going to get better from here with the carnivore lifestyle, because like I said, I'm not changing it at all. So make sure you guys watch those videos below about cholesterol, and also look at some of those studies that I posted in the description as well. And if you guys have any questions, comments, or even concerns about me, go ahead and put those in the comments as well, because I would love to hear them and love to hear if you guys ever had any run-in with your doctor as well about your cholesterol being crazy high. And like always, don't forget to hit that like button and subscribe, and I'll see you guys soon.